large intestine channel. We begin the large intestine channel with large intestine 1. Large intestine 1 is the yin well and middle point of the large intestine channel. It is located on the dorsal aspect of the index finger at the junction of lines drawn along the radial border of the nail and the base of the nail, approximately 0.1 cm from the corner of the nail. This is large intestine 1. Large intestine 2. Large intestine 2 is the yin spring and water point of the large intestine channel. It is located on the radial border of the index finger in a depression just distal to the metacarpophalangeal joint. This point will be easier to find if the index finger is relaxed in a slightly flexed position. This is large intestine 2. Large intestine 3. Large intestine 3 is the shoestring and wood point of the large intestine channel. It is located on the radial side of the index finger in the substantial depression proximal to the head of the second metacarpal bone. This point is easier to locate when the hand is made into a loose fist. Needle with the hand in a loose fist position with the metacarpal bone lying in the same plane. This is especially important when needling deeply towards the opposite side of the hand. This is large intestine 3. Large intestine 4. Large intestine 4 is the one source of the large intestine channel. It is located on the dorsum of the hand between the first and second metacarpal bones, at the midpoint of the second metacarpal bone and close to its radial border. Ask the patient to squeeze the thumb against the base of the index finger and locate large intestine 4 at the highest point of the bulge of the muscle and approximately level with the end of the crease. This point, large intestine 4, is contraindicated in pregnancy. Large intestine 5. Large intestine 5 is the yin river and fire point of the large intestine channel. It is located on the radial side of the wrist in the center of the hollow formed by the tendons of extensor pollicis longus and brevis. This is the anatomical snuff box. Ask the patient to extend the thumb to emphasize the hollow of the anatomical snuff box. Look carefully to locate the cephalic vein which runs through the anatomical snuff box in order to avoid needling through the vein. Now we go to large intestine 11. Large intestine 11 is the Christi and earth point of the large intestine channel. It is located at the elbow, midway between large intestine lung 5 and the lateral epicondyle of the humerus at the lateral end of the transverse cubital crease. This point should be located with the elbow flexed. Now we go back to large intestine 6. Large intestine 6 is the connecting point of the large intestine channel. It is located 3 cm proximal to large intestine 5 on the line connecting large intestine 5 to 11. Locate with the elbow flexed and with the radial side of the arm upwards. Divide the distance between large intestine 5 and 11 into half, then half the distance between this midpoint and large intestine 5. This is large intestine 6. Large intestine 7. Large intestine 7 is the C-cleft point of the large intestine channel. It is located 5 cm proximal to large intestine 5 on the line connecting large intestine 5 to 11. Locate with the elbow flexed and with the radial side of the arm upwards. Divide the distance between large intestine 5 and 11 into equal parts, then locate large intestine 7 1 cm distal to this midpoint. Large intestine 11. It's large intestine 10. Large intestine 10 is on the radial side of the forearm, 2 cm distal to large intestine 11, on the line connecting go to large intestine 15. Large intestine 15 is the meeting point of the large intestine channel with the yang motility vessel. It is located in a depression which lies anterior and inferior to the acromion at the origin of the deltoid muscle. Note that Sanjiao 14 is located in the depression which lies posterior and inferior to the acromion. If the arm is abducted, the two hollows will be more easily palpable and often visible. Now we go back, after seeing large intestine 15, to large intestine 13. Large intestine 13 is located on the lateral side of the upper arm, 3 sun, proximal to large intestine 11, on the line connecting 11 to 15. Locate approximately 1 handbreadth superior to large intestine 11, in the depression between the lateral border of the biceps brachii and the humerus, and locate 1/3 of the distance between large intestine 11 and the axillary fold. Now we go, this is large intestine 13, and we go to large intestine 14. Large intestine 14 is the meeting point of the large intestine channel with the small intestine and bladder channels. It is located on the lateral side of the upper arm in the visible and tender depression formed between the distal insertion of the deltoid muscle and the brachialis muscle, approximately 3/5 of the distance along the line drawn between large intestine 11 and 15. This point is easier to locate if the muscles of the upper arm are tensed. This is large intestine 14. Large intestine 16. Large intestine 16 is the meeting point of the large intestine channel with the yang motility vessel. It is located on the upper aspect of the shoulder in the depression medial to the acromion process and between the lateral extremity of the clavicle and the scapular spine. Caution with this point, deep medial insertion carries a risk of causing pneumothorax, particularly in thin patients. And we end our large intestine channel with large intestine 20, which is the meeting point of the large intestine and stomach channel. It is located on the nasolabial groove at the level of the midpoint of the lateral border of the ala nasi. This is large intestine 20.